Hi everybody, today I am going to talk about an extremely important illness which is very common throughout the world, and that is hemorrhoids. Hemorrhoids, also called piles or swollen veins in your anus and lower rectum, similar to varicose veins. Hemorrhoids can develop inside the rectum, which are known as internal hemorrhoids, or under the skin around the anus, which are known as external hemorrhoids. Nearly 3 out of 4 adults will have hemorrhoids from time to time, so you can imagine how common this illness is. Hemorrhoids have a number of causes, but often the cause is unknown. Fortunately, effective options are available to treat hemorrhoids. Many people get relief with home treatments and lifestyle changes, which I am going to tell you in a short time. First, let me tell you about the symptoms. Signs and symptoms of hemorrhoids usually depend on the type of hemorrhoids. I'll tell you about the symptoms of external hemorrhoids. These are under the skin around your anus. Signs and symptoms might include itching or irritation in your anal region, pain or discomfort, swelling around your anus, and bleeding. Now I'll tell you the symptoms about internal hemorrhoids. These internal hemorrhoids lie inside the rectum. You usually cannot see or feel them, and they rarely cause discomfort. But straining or irritation when passing stool can cause painless bleeding during bowel movements. You might notice a small amounts of bright red blood on your toilet tissue or in the toilet. A hemorrhoid to push through the anal opening, that is prolapse or protruding hemorrhoid resulting in pain and irritation, can be seen also. There is another condition which is known as thrombus hemorrhoid, which is a form of external hemorrhoids. If blood pools in an external hemorrhoid and forms a clot that is known as thrombus, it can result in severe pain, swelling, inflammation, a hard lump near your anus. If you have bleeding during bowel movements or you have hemorrhoids that do not improve after a week of home care, you should talk to your doctor. Do not assume rectal bleeding is due to hemorrhoids, especially if you have changes in bowel habits or if your stools change in color or consistency. Rectal bleeding can occur with other diseases including colorectal cancer and anal cancer. You should seek emergency care if you have large amounts of rectal bleeding, lightheadedness, dizziness, or faintness. Now let me tell you about the causes. The veins around your anus tend to stretch under pressure and may bulge or swell. Hemorrhoids can develop from increased pressure in the lower rectum due to straining during bowel movements, sitting for long periods of time on the toilet, having chronic diarrhea or constipation, being obese, being pregnant, having anal intercourse, eating a low-fiber diet, regular heavy lifting. Now coming to the risk factors. As you age, your risk of hemorrhoids increases. That is because the tissues that support the veins in your rectum and anus can weaken and stretch. This can also happen when you are pregnant because the baby's weight puts pressure on the anal region. Now I'll tell you the complications. Complications of hemorrhoids are rare but include anemia. Rarely, chronic blood loss from hemorrhoids may cause anemia, in which you don't have enough healthy red blood cells to carry oxygen to your cells. Another complication is strangulated hemorrhoid. If the blood supply to an internal hemorrhoid is cut off, the hemorrhoid may be strangulated, which can cause extreme pain. The third complication is blood clot. Occasionally, a clot can form in a hemorrhoid, which is known as thrombus hemorrhoid. Although not dangerous, it can be extremely painful and sometimes needs to be lanced and drained. Now let me tell you the preventive measures. The best way to prevent hemorrhoid is to keep your stools soft so that they can pass easily. To prevent hemorrhoids and reduce symptoms of hemorrhoids, you should follow the tips which I am going to tell you now. You should eat high fiber foods, eat more fruits, vegetables and whole grains. Doing so softens the stool and increases its bulk, which will help you avoid the straining that can cause hemorrhoids. Add fiber to your diet slowly to avoid problems with gas. You should drink plenty of fluids. Drink 6 to 8 glasses of water and other liquids, not alcohol. You should remember this. You should drink these liquids each day to help keep stools soft. Also, you can consider fiber supplements. Most people do not get enough of the recommended amount of fiber, which is 20 to 30 grams a day, in their diet. Studies have shown that over-the-counter fiber supplements such as psyllium, also known as metamucil, or methyl cellulose, which is known as citrusel, and another name for this. These improve overall symptom and bleeding from hemorrhoids. If you use fiber supplements, be sure to drink at least 8 glasses of water or other fluids every day. Otherwise, the supplements can cause or worsen constipation. Do not strain. Straining and holding your breath when trying to pass a stool creates great pressure in the veins in the lower rectum. So you should keep this thing in your mind. Go as soon as you feel the urge. If you wait to pass a bowel movement and the urge goes away, your stool could dry out and be harder to pass. Exercise. Stay active to help prevent constipation and to reduce pressure on veins, which can occur with long periods of standing or sitting. Exercise can also help you lose excess weight that might be contributing to your hemorrhoids. Well, on my channel with BB, I have posted videos about exercise and benefits of walking. Please see those videos, which are really very, very beneficial. Also, another preventive measure is that you should avoid long periods of sitting. Sitting too long, particularly on the toilet, can increase the pressure on the veins in the anus. Now, I'll tell you about the diagnosis of hemorrhoids. Well, your doctor might be able to see external hemorrhoids. Diagnosing internal hemorrhoids might include examination of your anal canal and rectum. That can be carried out through digital examination. Your doctor inserts a gloved, lubricated finger into your rectum. He or she feels for anything unusual such as growth. Also, we can carry out visual inspection because internal hemorrhoids are often too soft to be felt during a rectal exam. Your doctor might examine the lower portion of your colon and rectum with an anoscope, proctoscope, or sigmoidoscope. Now, I'll tell you about further test. Your doctor might want to examine your entire colon using colonoscopy if your signs and symptoms suggest you might have another digestive system disease. You have risk for colorectal cancer. You are middle-aged and haven't had a recent colonoscopy. There are other illnesses which can cause bleeding per rectum. So if we have a suspicion about other illness, we can carry out colonoscopy or other tests as well. Now I'll tell you about the treatment of hemorrhoids. First, I'll tell you about home remedies. You can often relieve the mild pain, swelling, and inflammation of hemorrhoids with home treatments, such as by eating high-fiber foods. Eat more fruits, vegetables, and whole grains. Doing so softens the stool and increases its bulk, which will help you avoid the straining that can worsen symptoms from existing hemorrhoids. You should add fiber to your diet slowly to avoid problems with gas. You can use topical treatments. Apply an over-the-counter hemorrhoid cream or suppository containing hydrocortisone, or use pads containing witch hazel or a numbing agent. You soak regularly in a warm bath or sitz bath. Soak your anal area in plain warm water for 10 to 15 minutes 2 to 3 times a day. A sitz bath fits over the toilets, as you can see in the images which I am posting in my video. Also, you can take oral pain reliever. You can use acetaminophen, that is Tylenol, and other which comes with other name, aspirin or ibuprofen, which comes with the name of Advil, Motrin. These can temporarily help reduce your pain or discomfort. With these treatments, hemorrhoid symptoms often go away within a week. You should see your doctor in a week if you do not get relief, or sooner if you have severe pain or bleeding. Coming to the medication, if your hemorrhoids produce only mild discomfort, your doctor might suggest over-the-counter creams, ointments, suppositories, or pads, which I told you before. These products contain ingredients such as witch hazel or hydrocortisone and lidocaine, which can temporarily relieve pain and itching. Do not use an over-the-counter steroid cream for more than a week unless directed by your doctor, because it can thin your skin. Coming to the other treatments. Now I'll talk about external hemorrhoid thrombectomy. If a painful blood clot, that is thrombosis, has formed within an external hemorrhoid, your doctor can remove the hemorrhoid, which can provide prompt relief. This procedure, done under local anesthesia, is most effective if done within 72 hours of developing a clot. And now I'll tell you some minimal invasive procedures which are helpful for treatment of hemorrhoids. For persistent bleeding or painful hemorrhoids, your doctor might recommend one of the other minimally invasive procedures available. These treatments can be done in your doctor's office or other outpatient settings and do not usually require anesthesia. The first option of minimal invasive procedure is rubber band ligation. Your doctor places 1 or 2 tiny rubber bands around the base of an internal hemorrhoid to cut off its circulation. The hemorrhoid withers and falls off within a week. Hemorrhoid bending can be uncomfortable and cause bleeding, which might begin 2 to 4 days after the procedure but is rarely severe. Occasionally, more serious complications may occur. The second option is injection, that is sclerotherapy. Your doctor injects a chemical solution into the hemorrhoid tissue to shrink it. While the injection causes little or no pain, it might be less effective than rubber band ligation, which I told you just now. The third option of minimal invasive procedure is coagulation, which is done by infrared laser or bipolar. Coagulation techniques use laser or infrared light or heat. They cause small bleeding internal hemorrhoids to harden and shrivel. Coagulation has few side effects and usually cause little discomfort. Now I'll tell you about some surgical procedure. Only a small percentage of people with hemorrhoids require surgery. However, if other procedures have not been successful or you have large hemorrhoids, your doctor might recommend one of the following, which I'm going to tell you now. The first is hemorrhoid removal, that is known as hemorrhoidectomy. Choosing one of the various techniques, your surgeon removes excess tissue that cause bleeding. The surgery can be done with local anesthesia combined with sedation, spinal anesthesia, or general anesthesia. Hemorrhoidectomy is the most effective and complete way to treat severe or recurring hemorrhoids. Complications can include temporary difficulty emptying your bladder, which can result in urinary tract infection. This complication occurs mainly after spinal anesthesia. Most people have some pain after the procedure, which medications can relieve. Soaking in a warm bath also might help. The second option is hemorrhoid stapling. This procedure, also called stapled hemorrhoidopexy, blocks blood flow to hemorrhoidal tissue. It is typically used only for internal hemorrhoids. Stapling generally involves less pain than hemorrhoidectomy and allows for earlier return to your regular activities. Compared with hemorrhoidectomy, however, stapling has been associated with a great risk of recurrence and rectal prolapse, in which a part of the rectum protrudes from the anus. Complication can also include bleeding, urinary retention, and pain, as well as rarely a life-threatening blood infection, that is sepsis. Talk with your doctor about the best option for you. Well, this was all about hemorrhoids. I hope you like this video, and if you have hemorrhoids and any other illness, please post your comments and I'll try to reply to your comments as soon as possible. If you have any other illness, if you want me to make a video about that illness, please post in comment section.